Good evening. I'm Mayor Cedric Williams, and I want to welcome you to our event this evening. And first of all, just thank you to Governor Hutchinson. Thank you to Dr. Romero for coming back to our Forrest City community. People in the back, if you can, come up and take some of the seats up front. Those in the very, very back are giving vaccinations back on that set board. And it's a big thank you in the back that's giving vaccinations as part of our event this evening. We have Dr. Kelly Ferris with the Lee County Cooperative Clinic. Y'all raise your hands back there. And also we have our local St. Francis County Health Department that's giving vaccinations back there. Raise your hand. And let's give them a round of applause. Because truly they have made a difference today. There are several people, they've been busy, since 5 o'clock. Several people that were very hesitant about taking the vaccination has come in and received their vaccination today. So that's truly, truly a win for our entire community. So thank you for your efforts that being here today of that. So on behalf of all the city officials of the city of Forrest City, again, we welcome you, Governor Hutchinson and your entire staff, to here in Forrest City again. Let Representative Murdoch say a few words to bring you up, and thank you for being here.
Good evening. Again, as the mayor said, thank you all for coming out to be a part of this very important event, this public awareness event. I always like to say teamwork makes the dream work. And whenever I'm in this area and I have something to do of any major collaboration, I always call on my good friend, Mayor Cedric Williams. And again, he's done a great job in facilitating this. And let's give him a hand in the city of Forrest City for what they've done. Of course, I'd be remiss if I didn't thank the person I'm introducing. I mean, it's amazing, to see, since I've been in the legislature now, you guys have allowed me to serve you for the last 12 years, and I'm so humbled by that. But what makes it worthwhile is the relationships that you develop in that time. And since Governor Hutchinson has been here, been a governor, he's been a friend, he's been there for the Delta, there for me, and all of us. And whenever I've called on him, he's done what he's doing today. To me, you guys, that means so much, that when you call on the top official of the state and you say, I got an issue, I got a problem, hear me, help me, come see me. Governor Hutchinson has done it again. He's not the first time I've asked him or people that's working under him from the Department of Health and others. Dr. Romero's here, former secretaries have been here, education, economic development, everybody on his team comes to help me. I appreciate the relationship. I appreciate what you do. Thank you so much for being here. And thank you all. This is for you. This is the reason why this needs to happen. Please listen. Please pay attention. Let's answer questions. Let's be engaged. And let's get better. Thank you so much, Governor Hutchinson.
Thank you. Representative Murdoch, thank you for your comments. And everyone should know that whenever I announced that we were going to do community COVID listening sessions, conversations across the state, one of the first texts I got was from Representative Murdoch saying, come to our community, Marianna, Forrest City. And Mayor, it is so great to see you again. You're a great leader. We spent a lot of time together on different issues, and thank you for hosting this event tonight that I believe is important, not just for our community, but for our state as well. And I'm grateful for our health clinic that's back in the back. It's already applauded you, but I salute you. Thank you for the work that you do for our citizens. And today has been a pretty interesting day. Last night we were in Batesville for our community COVID conversation, and then today I was in Blytheville, and then my toughest was I spoke to Arkansas State University football team. And boy, there's a lot of them, and they're all big. And they had very good questions. And so I was making the case to them we got to get vaccinated. If we're going to have a season, if we're going to get through the season, this is a time to do it. And a great conversation with them. And then down here, the capstone of the day here in Forest City. And then tomorrow, Dr. Romero, our Secretary of Health, has been with me through this and be answering questions tonight. But his team and I will be in Texarkana tomorrow for another session. So we're covering the state. I think this is important. But let me set the stage for you. And over the past month, we have seen a significant increase in the number of daily COVID cases, hospitalizations, and new cases each day. And let me illustrate it. On June 7th, about a month ago, a little over a month ago, Arkansas had 1,594 active cases, 1,500 active cases. July 9th, one month later, it had gone to 6,605 active cases. On June 7th, we were down to where we're having new cases each day of about 62. July 9th, 1 month later, we had new cases of 1,155. And then today, we've had an additional 1,200 cases a day with scores of new hospitalizations. On hospitalizations on June 7th, we had 175 Arkansans that were hospitalized. One short month later, on July 9th, we had 497 hospitalized, and now we're well over 500 hospitalized. Now, what made that big difference, which I will talk about here in just a moment, but first let me look at some of the vaccination rates. The vaccination rates for St. Francis County, Forest City, and we'll look at Lee County as well. I think we have St. Francis County that's up on the screen. You can see that there. And on the left side, you'll see the number that has been fully vaccinated, and that is, well, I've got to look at my notes here. That is Forest City. So in Forest City, 36.5% have been fully vaccinated. And then the darker one on the right, which says 29.2%, that's for the county. And so you can see our vaccination rate for Forest City, 36.5%. For the county as a whole, 29%. That's actually not the same level of variance that we see in many places where the city is very high, but the county is very low. Now, if you look at Lee County, and I've got a little credit, Mariana, the vaccination rate is 44.6% in Mariana, in the city of Mariana. The county-wide in Lee County is 25.9%. We don't have a graph for that, but I'm giving you those numbers. And so you can see the work that we have to do. Now, you might ask the question, why are we having this surge here in Arkansas again? And there's two reasons. One is we have the Delta variants, the Delta variant. And this is a variant that is more transmissible than the original virus. It's transmitted more easily. And secondly, it gets you to the hospital quicker. Not that we want to go to the hospital, but there's 2 times more likely to go to the hospital with the Delta variant than it is with the original virus. Now that needs to soak in just a little bit. You think about your relatives and friends that might have got COVID last year, and they said, well, they didn't bother them that much. You know, they stayed at home, they didn't go to the hospital. Well, it doesn't mean it's going to be true for the Delta variant because it's twice as likely to get you to the hospital. And so the Delta variant is not just here in Arkansas, but it is the dominant variant here in this state, and nationwide, over 50% of the new cases are from the Delta variant. It originated in India, it mutated, it came here, it was in Missouri, it came down to Arkansas, and so we're having to deal with that, and that's a serious issue. The second challenge that we have is the low rate of vaccinations in Arkansas. We, just as you can see from this, and we can compare the record that we have here with what's happening nationwide. Nationally, 55% of the population has received at least one shot and 48% fully vaccinated. And so compare that to 36% nationwide is 48% fully vaccinated. And if you look in Arkansas, 35% statewide are fully vaccinated. And so the low vaccination rate makes it easier for the Delta variant to move through our society. Now, I make the case, it might be curious to you, that if you look at some of the states that are high vaccination rates, Vermont, 66%, Massachusetts, 62%, Maine, 62%, Connecticut, 62%, Rhode Island, 60%. Why are those states so high in their vaccination rate? Well, maybe it's because I don't know the answer to that. I don't know the answer to it, but what they have in common is they're all in the Northeast. They're fairly highly educated communities, and they took that vaccine very quickly, and they've adapted to it. Now, it's a more dense population as well. But look at the states with the lowest percentage of population that's fully vaccinated. Alabama, Mississippi, Arkansas, and Louisiana, and somehow Wyoming got in that mix. But what do those states have in common? Rural states, most of them are southern states, some of them Delta states. And so we have unique challenges here that we have to overcome. This is an urgent moment. It is an urgent moment that we are facing in Arkansas and our nation right now. It is urgent because school is starting in another month. We've got our superintendent of schools here, we've got educators here, teachers here, and they know that we have to accelerate getting teachers vaccinated and students at over 12 vaccinated. Otherwise, we're going to have more cases arising out of our schools, and we want to have school. We're committed to having that, but we need help during this next 30 days to act with urgency in getting the vaccine out. Secondly, as I mentioned, the Delta variant is gaining ground, and the good news is that there is a solution. There is a solution, and that is vaccination. People say, well, how do I, avoid going to the hospital, get a vaccination? Well, how do I stop worrying if I send my 16-year-old to school? Make sure they are vaccinated. If you're a teacher, how do you stop worrying about going to school? Get vaccinated. If you say, well, I don't want to go back to work because the Delta variant might be at work. Well, the good news is that the vaccine covers the Delta variant. You're safe if you go back to work. And so the solution is there with the vaccine. Now, the questions that have already been submitted to us are tough, and that's why Dr. Romero is here. I say they're tough. They have answers, but they're very good questions you presented. But before I start going through some of the questions, I want to turn it open first and to see if you've got questions. And I'll probably mark off one of them on the list here, but I'd love to hear from you, and that's the reason we have this. It's a conversation that we listen, and these community conversations have really produced some great ideas. I was up in Blytheville today, and afterwards the coach came up to me and said, we're having the football physicals coming up. I think I'm just going to have a vaccination clinic at the same time. Great idea. And then, other ideas come about. Someone raised the point that, our population doesn't always have access to the internet, so we need printed material. And so, do we have that printed material here tonight? So if you need printed material, that was an idea that came from these community conversations. There's some that's available over there to you. And so a lot of good ideas come from it. I'm anxious. And I think what we have to address here in this community is how can we overcome hesitancy? Do people in your community have access to the vaccine? And what more can we do as a community to educate people? With that, I'm going to turn it open for questions. We've got microphones here that's available. Yes, ma'am.
So my name is Debbie, and I would like to start with the PCR rate. The Nobel Prize winner, Gary Mullis, was the inventor of the PCR rate itself. Unfortunately and mysteriously, he ended up dead 2 months before this came out, this COVID. So he told all of everybody, all the doctors and everybody, you could not use the PCR testing to test people and get accurate results because it would pick up everything and give false positives. Secondly, the rates that you give up here has nothing to do from the VAERS report. It doesn't give us any information. Most of these people that are in the hospitals now are people that have been injected. They've been magnetized.
Been injected with what?
With the Moderna. The Moderna has been known to have a light in the injection area. It's been known to magnetize the area. There's been testing on, just recently, 30 non-vax, 30 vax people. 30 out of 30 non-vax people, they could take a spoon, any kind of metal, it would not magnetize, nothing. On the vax people, and you could search this, DuckDuckGo, everywhere. The people that were vaxxed, you could get a piece of metal, anything metal, and it would stick to the spot.
Okay, so I've got one question is about the validity of the PCR test. Yes. The second point you've made is that most of the people in the hospital have been vaccinated.
Yes.
And so let me address those two things. I'm going to ask Dr. Romero to talk about the PCR test. Of course, we have multiple tests. We have the PCR test, we have the antigen test, and these are tests that we use to determine whether somebody is positive for COVID or not. And this is something that's used nationally. Arkansas is not unique in it. But the most important thing is about the hospitalizations. And the statistics are that we have, I believe it's, of all the people that's been in the hospital because of COVID, 98% of those were not vaccinated. And so those that are in the hospital, 98% are not vaccinated.
How come you don't know any of that and we don't have any facts? Anything
Well,
sorry to interrupt you, but anything that we put in social media platforms try to communicate with anybody gets censored and taken down. It throws real big red flags for people, the Americans, why hydrochloroquine and ivermectin cannot be talked about on any social media platform at all.
Okay. The PCR, Dr. Romero, you want to address that?
Thank you, Governor. So the PCR is the most sensitive and specific test for diagnosing the COVID virus. The standards for diagnosing it are determined by the FDA, and the limits for that have been well established. So it can be used. It has been used. Dr. Mullis, one of the greatest, that's why he got the Nobel Prize, is that it is one of the most effective diagnostic tools that we have today. And it is used for any type of infectious disease that has genetic material in it.
But what did he himself say about it from 60 Minutes
Okay.
years ago talking about it?
We want to pass this around. You've made some very good points. Do we have anybody from the hospital here? We don't have anybody from the hospital here. Okay. Can I ask, where do you get your information that you rely upon?
I get it from AmericasFrontlineDoctors.org. There's a group of doctors that have come together. They were standing outside in front of the White House at the start of all of this, and they told that there was a cure, which is called hydrochloroquine. I am, in fact, on hydrochloroquine because I have severe rheumatoid arthritis. It is a cheap, effective drug, and I know for a fact that people that did come down with this common cold / flu virus that's been called COVID was out. COVID was out a long time ago. It was on the Lysol cans, spray for COVID. 99%, 9% kills the virus. It was patented years ago. All this is documented.
Okay, and that hydrochloroquine is available. It's a decision between the physician and the patient.
Yes, but the
That's-
physicians, I'm sorry, but
ma'am,
the doctors' licenses were pulled.
No doctors, well, anyway, much of the information, I remember that news conference of those doctors that you were referring to.
I'm thankful.
Much of that has been discredited. But the most important fact that you have cited that everybody needs to understand that there is no dispute about is that the people who are going to the hospital for COVID are those that have not been vaccinated. That's the most important fundamental.
Okay, so the CDC report had the VAERS report up on it. The VAERS report is not listed there now anymore. The VAERS report did list the vax versus non-vax.
You can talk to any hospital in Arkansas and get the validation of what I just said. This is not difficult. Every hospital administrator will tell you exactly what I am telling you. All right. Yeah, your question?
Hello. My name is Linda, and I guess my last job would be the CDC. We're looking at COVID as a community, a healthy community. Okay, that's what COVID is. What if I was working at the health department and I was toting a bag of trash out to the trash every day? The health department. What if, no gloves on, no type of equipment that would protect me from a disease or germ. We're dealing with the health department. That's where people get tested for all types of diseases. And I actually caught an infection. And I go back to my home. There's my kids get infected. Then my kids at home, they go out to the playground and play. The kids are infected. Other kids are infected. They go to the schools. They infected. Okay, this is what it is. And the reason infections sometimes occur is unhealthy, safety homes. Some people, it's there. So when you're not helping someone live, according to you, being vaccinated because you are living a healthy, clean life, you want to keep that. So the main point is CDC and all this evaluating of this is we got a covering now of better homes since we started, but it's still that percentage that hasn't been vaccinated is the percentage that we need to focus on. That is the problem across the world, is us not looking out for one another. That right there itself. And to do that within the education departments, we're going back to school, these kids need to learn to do that. And the only way they're gonna learn to do that, I asked for the simple, I don't have my book today, I was in a hurry, but it's the Bible. It's a K-12. It simply teaches them how to love one another. And how we learn that is through Christ. And those books give them apps. It makes them, in their school, teaches them, that very reading of the day that we all as adults.
Do you encourage people to get vaccinated?
Yes.
All right,
I'm
thank you.
second.
Thank you. Well said. Thank you.
Governor, we have a question here.
Okay.
My main question is, what is the efficacy of the 3 vaccines available against the Delta variant nationwide? And then to share something as a nurse practitioner in a primary care clinic in our community, we are not seeing a lot of COVID right now in our vaccinated population, which is tremendous. The COVIDs we are seeing are more in those that are not vaccinated or under-vaccinated and have not gotten the second shot. I have one more question besides efficacy. In the past week, I've had 2 kids under the age of 1 that tested positive for COVID. And the only reason we tested them, their parents were both positive and they wanted to know the status of their child. How close are we to having a vaccine for our younger group of kids?
Okay, so the first part of the question is the efficacy of the 3 vaccines against the variants. Dr. Romero.
So that data is under evolution, but what we have right now, we know that for the Pfizer and the Moderna vaccines, there is strong data to suggest that it protects against infection. Now, for the Johnson & Johnson vaccine, because it's not being used and wasn't used as much as the others, that data is coming in, but it also shows that it is efficacious against the vaccine, against the Delta variant and all the other variants that are in this country. Governor, you want me to talk about the childhood immunizations? Or
Yes, go ahead. Well, and Dr. Romero is the right one. He's a pediatrician epidemiologist who also is on the national committee that really studies the data on the vaccinations.
Thank you, Governor. So, the studies are underway at this point. We believe that towards the end of this year, data will be submitted to the FDA for their review. Once they review it and show that it is efficacious and safe, it'll be passed on to the ACIP. That's the committee that the governor was referring to that I'm on. And then they'll make a recommendation. So I think that we may have vaccine for these children from 12 to 6, by the end of the year. We'll need to wait till later for the other ones. But if I may add one other thing. So that is exactly the problem that we have right now. We don't have vaccines for these little ones. And the way to protect them is for us, the adults, to get the vaccine so that we can form a cocoon, if you will, around them and not bring the virus into the home. So thank you very much for pointing that out.
Thank you. That's something that I thought of this week, that having the 2 kids, where parents may not want to get it to protect themselves, we would do pretty much anything to protect our kids. Channel 3 News shared a statistic today that there are 10 kids in the state of Mississippi at their children's hospital on ventilators. So if we think this is not serious in kids, we're fooling ourselves. Because it can be.
All right, we got a couple more questions here, and y'all are doing great. Love, I appreciate the respect that you show each other and keeping it fairly brief, so it's really great. We'll get around to just about everybody. Yes, sir.
Governor, I think you have to address the problems in regard to misinformation. I think that's going to be a pain point in Forest City, but also in regard to healthcare education. I'm pretty sure, and it's safe to say that majority of people in here have got the vaccine. Now, following us getting the vaccine, how do we increase education and access to healthcare after we get the vaccine? Because we're still in a food desert, and we're still not at the point that Maryland, Massachusetts, and Maine are, because they still have most of the people vaccinated in their population. But we have to address education, healthcare, and misinformation.
I agree 100% with you. This is part of it right here. And, you know, it's interesting. We get a lot of people come here and actually do get vaccinated, but it's information primarily and ideas. So we've got to look at how we can improve that. We're using marketing, we're using radio, we're using trusted advisors. And anytime you talk to somebody that they're skeptical, encourage them to go, who do they trust? Do they trust their pastor? Do they trust their doctor or their nurse practitioner? Encourage them and go and talk to those trusted advisors to get the right answers. And we also have our health clinic. Who's our health clinic here? Please stand up and introduce yourself.
Yes, thank you, Governor. I am Kelly Ferris, the CEO at Lee County Cooperative Clinic. And we serve Lee County, St. Francis County, and Phillips County. And so when you think about having access to the vaccine, we have access to the vaccine. We have a large stock of vaccine. We need to educate, and the young man said what we have to do in this area. We have access. We can get you to the vaccine. We offer transportation to our patients and non-patients. All you have to do is give us a call. We will bring the vaccine to you if you cannot leave your home. So you have access to the vaccine, but we just have to continue to educate people. We have to encourage each other. I may be the CEO, but I will sit down with you and walk you through it step by step. If you have any questions, our staff are trained to be on the same page. And I'm so proud of our staff here today. They are here after hours because they know the importance and they want to help you get through this. So please contact us if you have any questions after this evening. And we'll be happy to answer them.
Thank you very much for your leadership. We will go back here. We got some other people to hear from. So who you got?
We had a question back here
Izzy?
first, yes.
Governor, thanks for coming also. We've done a whole lot here in our Forest City, the mayor and everyone involved with drive-in clinics, every kind of clinic, including the clinic back there today. I don't know how you can lead a horse to water, but you can't always make him drink. And I think that's why you're here today, is trying to find a way that we all could come together to find a way to get that horse to drink. But my mom, 95 years old with Alzheimer's, if I would walk out here, it means I got to go back home because I'm a caregiver. Yeah. But I put her in the car, rolled out there, struggled to get her in the car, drove her through the drive-through. But at the same time, to close it out real quick, they had a food line there. We thought we were going to be in line for a long time. Everybody was there to get the free food. We need to find ways to connect with those kind of free operations to get people to come out and get their shots. And like a nurse practitioner said on the news today, I think it was 10 children in ICU on ventilators in Mississippi. We don't want to go there, and I know that you have your hands tied in regards to the face masks, but I don't know what we're going to do if this thing goes higher and higher because the legislature tied your hands. Thank you.
Listen, well said, absolutely. And I love that idea. You know, we ought to talk to our food bank teams that whenever they have a food bank that's open or a drive-through, make sure we have vaccination that's available at the same time. Great idea. Thank you. All right, over here.
Yes, thank you, Governor. I would just like to know if I could get some information on where the surges are, where the hardcore surges are of the Delta variant in Arkansas, because I know some places have a stronger surge than others, and I would just like to know where are the strong, you know, where the people are really catching the virus.
Well, it's our testing, and we take samples of multiple cases, and we send them in, and we get them tested, we get the information back. And so the Delta variant is spread throughout Arkansas. Now, it first was most significantly concentrated up in northern Arkansas because that was close to Missouri. But you can count on the Delta variant being in each area of Arkansas. Our testing does show that. Dr. Merrill,
That's exactly right. We have widespread community spread of this, and at last week's count, 3/4 of the viruses that were found to be variants were Delta variant, and that's from all around the state.
Okay, I'm going to, who do you have? Yes, go ahead.
Thank you. Just a point of misinformation and hopefully something that is helpful. I took my first shot in January. I was afraid, and I sat there and watched. What I want everybody to understand, we've had so much misinformation. What encouraged me the most was I sat there and watched. That's how they gonna switch bottles. Nobody switched bottles. Everybody got it out to say, I'm safe here. I mean, this is a lot of things that's going around. Yeah. And I sat there and I just watched. I did not have any major effects. I had a little soreness. These are some of the things that we need to make sure we get out. Yes, you go a lot more. Yes, you're gonna have a little soreness, but you're gonna get over it. And then lastly, we all, before we left the hospital as babies, took a shot. Before our babies get 6 months, they have at least 4 to 5 shots. Now, you're going to put your baby through it, but you won't put yourself. Thank you.
Thank you. Thank you. Well said. All right. Yes, sir.
Thank you for coming, Governor. And I just want to say, I'm going on my personal, like Brother Williams there. I was one definitely against taking the vaccine. And one guy said something to me in a meeting one night. He asked me, why are you afraid of it? And I said, well, I want to see how other people act after they take it before I take it. That's the dumbest reason in the world to not take a shot. And the thing about it is, I started watching and looking at the data on the people who are dying daily. And I'm on Facebook, and if you are a friend of mine on Facebook, you'll see that I started way back in the day when it was like people were, it was 3,000 and 4,000 people dying daily. Well, I didn't want to be one of those. Now, I took the Johnson & Johnson vaccine. I didn't do like Brother Williams. I didn't see if they changed bottles or any of that. But now, one thing I did do, and it's for the lady, the first lady that asked the question about the magnet on the arm. I did do that, and my magnet just fell to the floor. So I don't know where that's coming from. The only thing that I will say is this, and this is to the vaccine makers. You got Pfizer, Moderna, and Johnson & Johnson. If I own Coke, the last thing that I want in my commercial is about Pepsi. That's just something for you to think about. Who is giving this misinformation to us? Because it's easily given out, and it's not as easy to decipher where it's coming from. Take the shot. Take the shot. I did.
Let me talk about a source of some of the misinformation. Before I went to my first community conversation, someone forwarded me an email alert that was sent out by Secure Arkansas. It's an organization. It said, urgent alert. Our Arkansas governor and his cohort, Dr. Jose Romero, are starting their propaganda campaign called Vaccine Hesitancy. And it encourages everybody to show up there and gives them the questions that they ought to ask. And then it talks about the graphene oxide that's contained. It's not contained, but they say it's contained, and that gives mind control, and that gives the subjects inoculated with graphene oxide can be manipulated mentally by turning into different frequencies inside the 5G ranges. And then it goes on and says, here's the buzzwords that you should use if you want to attack the vaccine. They said buzzwords for the vaccine that we should be using, talk about the anti-vaxxers: bioweapon, genetic engineering, synthetic biology, genome therapy, reprogramming. Let me just tell you, this is what kind of garbage you get off the internet. And listen to your hospitals, listen to the community leaders that are talking here that's had that experience. All right, so next question or comment. All right.
She didn't do the mandates, and thank you. And she didn't, she's not pushing vaccines like here in other states in the world, in our country and in the world, and they've had the lowest rate. They're not doing the tests. Where do the tests come from? I've had medical examiners show and open up where the tests come from. So.
All right, fair question, thank you. Governor Christie Noem's a good friend of mine. She was in Arkansas recently. I introduced her. We talk all the time on our governor's calls, and she did not mandate masks to be worn, but said everybody has the right to wear a mask. It's their individual choice. They do test in South Dakota, so they do their PCR test, and they also have vaccines. And so, in fact, they had, and she was on national television talking about how quickly they were getting out the vaccines in the rural areas of the state, and did a pretty good job of getting the vaccine out. But you also will see that their cases are going up right now. And so no state is immune from, in fact, 47 of the 50 states right now, the cases are going up, and it's because of the Delta variant. So governors adopt different strategies. I like Kristi Noem, but they do vaccines, they do testing there, and they certainly are working to get that vaccine out. And we have no mandates in Arkansas right now. There's no mandate to wear a mask. There's no mandate to get a vaccine. The legislature has made it clear we're not going to do that. I ended the mandates. There's no mandates on businesses. Everything, what happens here on out is individual responsibility and decision making. And it's about the community. And that's why we're starting at the community level. Great question. Thanks for asking that. Thank you. Well, I'm grateful for the respect that you show everybody. Thank you.
Hey, Governor, we have one last question in the back.
All right, great.
Good evening, Governor. My name is LaTuan Weeb. I'm the director of the St. Francis County Food Pantry, and we will be glad to open up our pantry to service the vaccination for the community. You can might as well say I'm a COVID survivor and a cancer survivor. During Thanksgiving, I was diagnosed with COVID and spent 2 weeks in intensive care at UAMS. My great doctor team on the cancer floor, Dr. Van Ree and his staff, they took care of me, excellent care of me. And I just recommend anyone, now y'all all know me, I recommend anyone, get your shot, because I probably wouldn't be here today if I hadn't had that extra care from them. And then I went down and got me a Johnson & Johnson shot. And if they give another one out, I'll take it. Because either you want to live or you want to die. It's just plain and simple as that. There's nothing educational about it. Get your shots. Thank you.
Thank you. Yes, sir.
Why don't we have mandates? Why would I go to a doctor to get his advice and then don't do what he tells me? You're a governor, you're not a doctor, you're a politician. Everyone make up their own mind, say, I'm not gonna get the shot and killing their neighbor. Take the politics out of it. It's about the people. I mean, Republicans, Democrats, you all are fighting about, that's a lie, this is true, that's a lie, this is true. We're talking about people dying, and you say you have no mandates? Why don't you have mandates?
Well, the two mandates that usually people debate are whether there should be a mask mandate, and we want to incentivize people to get the vaccine, and one of the incentives is that if you get the vaccine, you don't need to wear a mask. And correct, and so you avoid COVID by getting the vaccine, or you can wear a mask. That's their choice. We recommend that you either get the vaccine or you wear a mask. We want everybody to get the vaccine. But the other thing on the mandate is, and there'll be a continued debate. For example, on the vaccine. Right now, it's emergency use authorization. And so we're waiting for FDA final approval, and we get that. You're going to see more businesses that will require a vaccine in their place of business for their workers. You'll see that, but right now, by law, we're restricted from mandating that. Okay, I don't have, so you're for, okay. Okay. You support mandate to everybody get a vaccine? Okay, I hear you. I hear you.
We have a question in the back.
All right?
I have two questions, and my son-in-law he took one of the got a shot. One I think it's the Moderna he took, and about a couple of days later he had a stroke and had to go to the hospital. And when he got out, the question he wants to know is should he could get a second one in that he had the stroke. So if he's had a stroke, should he get another shot?
Dr. Romero?
So a physician needs to have more information regarding your son's health and other issues before we make a recommendation. But we can provide that information. We can tell you where to go and ask those questions. If you have a trusted physician, I would go ahead and ask them the questions, and they can give you an answer. But without knowing more details about your son, I don't think I can offer you an answer. We have different types of vaccines. That we have vaccines that are of the type of the Moderna, and we have another type. So your son may be eligible for another type of vaccine. We just need to know a little bit about what's going on with him.
So would he contact a doctor about it, or what?
He can contact a doctor about it, or he can call the health department, and we can see if we can give him some information.
Okay. And the second question is, I'm asking for a friend of mine that can't be here tonight. The Johnson & Johnson, I heard, is it still safe to take?
So I think your friend may be referring to recent reports of something called Guillain-Barré syndrome, also abbreviated as GBS. And there is a signal associated with it. In other words, our safety systems in the United States are the best in the world. That's how we can find these signals. Right now, the CDC is going to look at that data. On Monday, we're going to look at that data, and then we're going to have a public meeting on Thursday to discuss whether we should continue to use Johnson & Johnson vaccine. But to this moment, Johnson & Johnson vaccine is still considered a safe vaccine.
Because I heard something this morning, I think it was, I live in Forest City, and I heard something this morning, I didn't get it all, about the Johnson & Johnson. I didn't know what they was
That's exactly
speaking
it,
of.
ma'am. You are exactly right. So there is this signal of called Guillain-Barré syndrome. It's a paralysis that is reversible, and it occurs very rarely with administration of this vaccine. They're trying to look at it closely. It can also occur with some flu vaccines, and it can occur after some infections that you get. So we're going to look at it. We'll have some more information for the public on Thursday of next week. For now, there's no contraindication other than what has been stated by the FDA. So.
Okay, I'd like to take the opportunity, the mayor submitted a number of questions that were collected from the community, is that right? And so not all of them have been answered, so I'm going to quiz Dr. Romero on a few of these questions. Oh, they're going to be tough. You get ready here. Now, the vaccines were rush developed. You look in history, and it took longer to develop vaccines for measles and smallpox and polio, and here we developed a vaccine within a year. Has it been sufficiently tested, and is it something we should have confidence in because it was so rushed?
So let me begin by saying that the vaccines that are cited, that is the polio vaccine, the measles vaccine, influenza vaccines, they were developed before we had these modern molecular techniques, the advances in science. So that has sped up the ability to develop vaccines.
Hold a little bit closer to you.
It has sped up the ability to create these vaccines. Also, because of a previous epidemic or pandemic by SARS #1, we had a lot of information already about the virus and its cousin. And so that sped everything up. Throughout the whole process, That is the whole process of development and testing of the vaccine. Safety has been paramount. That has been the most important thing that the FDA, the CDC, has been looking at. So, to date, we have enough data to say that the vaccines are safe, and furthermore, we have 5 safety systems in our country to follow the vaccines after they've been given. And those safety systems work because they've identified very rare occurrences, such as the allergy that occurs with some of these vaccines, such as the blood clots that occur with some of these vaccines, and possibly the neurologic problem. So we can find these very quickly, address them, and make recommendations about who should use it. The vaccines are safe.
All right, well, Dr. Romero, I feel like a trial lawyer here. I better be careful. So if they're safe, why are not a higher percent of nurses and hospital workers taking the vaccine?
Nurses, doctors, healthcare providers are humans. They are concerned. I heard a gentleman talk about he was waiting to see how some other people did after they had their vaccine. I like to call that's a good example. I like to call that the penguin phenomenon, where if you ever see penguins, they're on an iceberg, they push one guy off to see if he does okay in the water, right? Well, that's the penguin, and I say that affectionately because I like penguins. But that's what they're seeing. They're waiting to see how people are doing. And over time, we've gotten more people to accept the vaccine. There will always be those that have concerns, but they shouldn't be making the decision for you. You should be making your own decision.
All right, I'm going to put on, those are great answers, and I've never been more proud of the United States of America and their ability to develop a vaccine and showcase to the world that we can respond so quickly. To me, it really was a warp speed. It was everybody working together to do that, and I'm very proud that we were able to have a vaccine developed that the world wants. That the world wants and the world needs, and the greatness of America is sharing that vaccine. You know, and I asked the question about the doctors and the nurses. They are taking it at a very high level. But there is, you know, it's about a 70% level. Sometimes it's a little bit lower than that. But it also includes, you know, the custodians. It includes other people that work in the hospital. And as Dr. Romero said, you know, they need information, or they can, they're human as well. So I hope that goes up, just like teachers. Teachers, you know, probably being vaccinated about a 50% rate. We really need them to increase their vaccination level. There was a question here, is there a possibility that jobs will make it mandatory, really employers will make it mandatory to receive the vaccination? And if so, why? And, you know, while the state is prohibited by law from making it mandatory at the present time to take the vaccine, if you're a hospital, or if you're how about the Department, well, the Department of Corrections is government, but if you're an employer and you're concerned about safety in your workplace, you're concerned about the cost of insurance and healthcare cost, you want your employees to get vaccinated, they have the right to require employees to be vaccinated. That's their freedom of their business. Now, the employee has the right to say, I'm not going to work there if I don't want to get it. But that is something that will be a continued debate in the future. One of the, and it'll increase once the FDA gives final approval, which we expect within the next 30 days. Here's a question. If you're pregnant or trying to conceive, should you take the vaccine? And that is an important question. Dr. Merrill, could you answer that?
Yes, thank you. So data that currently exists indicates that it is a safe vaccine for women and they can become pregnant, that if it is administered during pregnancy, it is safe. But we recommend that women discuss this with their trusted physician, and that is usually their obstetrician, gynecologist, or their family practitioner who will be delivering, and they make a decision together. My colleague, Dr. Greenfield at the health department, generally recommends the use of this vaccine. He's an obstetrician and generally recommends this for every woman that is pregnant. he has told me stories, and I have seen the data. Women are at particularly high risk for adverse outcome if they are infected, and their babies too, because the baby relies on mom. And without mom, the baby goes into jeopardy. So you're protecting your baby, you're protecting yourself.
We have just about 5 minutes left. We try to keep it at an hour. We know it's late in the evening, or actually early in the evening, but we know there's other responsibilities that we have. I want to make a couple of comments. First of all, this has been a very good discussion. We have to have honesty in our communities, and I think this makes a difference as we get more information out. We're getting ready for school. We need to increase our vaccination. I want to ask Representative Murdoch, what's the ideas in Lee County as to how we can do better in getting the vaccine out? Is it the misinformation that's the biggest challenge? Is it the people in the rural areas just don't know where to get it? Or what is the issue that we could address as a community?
Thank you, Governor. I think it's a couple of things, and you've heard some of those today, and it's a combination of misinformation and fear. I think the biggest factor is fear and what you see and hear on social media. Many people pay more attention to social media than they do reliable news outlets, in my opinion, and I think social media has been a detriment to getting the virus out there in a positive way. I mean, the vaccine in a positive way. So hopefully we can continue to have forums like this. People talk to people. We all influence someone, so we have to get interested in others in our community, and hopefully our friends, our church members, our co-workers, they'll see us that have taken the vaccine, and many of us in here have, and they'll see that, you know, we didn't grow a third arm, and I hear all kinds of stories from my friends, from some of my good friends, about they waiting to see what's going to happen with me. And so, again, I think it's just a period of time is going to have to go by for us to really get there. But I think fear is the greatest, but I think we continue the effort. And I think the other side of that coin is, I think people saying that a lot of people sick and die. I think death is really something that is going to motivate us, because we've been to too many funerals, we've had too many loved ones on, in desperate situations. As my good friend Tawana Whitby, who we prayed for through his situation. So glad to see you're up and healthy, my friend. But again, hopefully, prayerfully, that we'll get through this. But I think it's fear.
I think it's going to be a motivating factor to increase vaccines. One last comment here, and then we're going to do one. I want to show you an ad that answers a question. It tells a story. Dr. Romero.
I wanted to comment about one question that I thought was very, very right on the mark. It was a question about how we can recommend this vaccine if it could affect individuals that are different with regard to race, gender, and health problems. And I think that's a very important question. And as a person of color, as a physician of color, I've always brought this up whenever we discuss vaccines. These vaccines have been trialed in ethnic and minority groups and groups with specific problems: weight, obesity, hypertension. We know that these vaccines are safe and effective in African Americans, Latinos, Pacific Islanders, because they're tested. We know they're effective and safe in diabetics because they've been tested. So that is a very good question. Rest assured that these vaccines have been trialed appropriately.
Let's roll the video. I'm grateful for that lady that shared her story. I think it's an important message. Mayor, thank you for opening up your city to us tonight. I want to thank everyone for expressing themselves very clearly, honestly, and we respect what everybody said tonight, and we came away with some very good ideas that we need to follow up on. With that, thank again the clinic back there. Hats off to you. God bless you and good night.